Jay Paul, you want to go first? So you're, okay. Okay, Jay Paul, don't go first. Okay. Go ahead, go.
I'm J. Paul Brown from 8 Nashville.
Cindy Dozier, Hinsdale County, and Chair-elect of Club 20.
Steve Child, Picken County.
Janet Farmer, Mount Crystal Butte. Christine Bogart, Grand Junction.
I am Frank Holt from Fruita.
Deanne Gibbs, Summit County.
And co-chair of the Healthcare Committee with me, Steve Reynolds from Glen Springs.
Chris Holstrom, San Miguel County.
Tom Jankowski, Butler County Commissioner.
Joe Hanel, Colorado Health Institute.
Don Mathis, Rock County.
Jack Taylor, Rock County.
Tim Carter, Rock County Commissioner.
Ray Beck, Locke County Commissioner and Membership Chair for Club 20.
Karen Harkin, Chapa, and Grand Junction. Joanne Snyder, San Miguel County, and I'm a rancher. Terry Lammers from Norwood. George Rossman, Congressman Tipton's office.
Les Mermelman, Cedar Edge, past chair, Club 20.
Kimberly Lindsay from Club 20, Membership Development Director.
Jennifer Price, AT&T.
And
I do have my mouthful. Nicole McCowan with Club 20.
And I'm Linda Gann with Connect Level, Colorado.
you moved on.
Came late to the table.
All right. So Nicole wants me to remind everybody of a couple things. Just the rules for Club 20 meetings is that all Club 20 members are asked to sit at the table if there's room. If you're not a Club 20 member, allow Club 20 members to have seats at the table. We appreciate everyone for being here today. One of the things that we're starting this year is instead of taking minutes, we're recording minutes. So if you don't say what you say into a microphone, you didn't say it, right, Nicole?
That's right.
All right. When we speak, as we have discussions, everybody's welcome to participate. Please raise your hand and wait to be acknowledged by either myself or Dan as the co-chairs before you speak, and be respectful of everybody. For those Mike on the phone yet, do you know?
I heard somebody calling
Steve, Mike Ukari is on. Can you hear me?
I hear you, Mike. Thank you. And so that, what did I forget? Okay, and when we take votes, if we do decide to do anything today, only full members of Club 20 are supposed to vote. If you're not a member, please don't vote. Yes, Nicole?
Additionally, if you need to use the restroom during the meeting, you will need an access card, such as Kimberly has, to access those restrooms. They are on the back table where you picked up all of your meeting info material, and then you can just swipe them on the black key, the black fob mechanism at the doors right outside, and it'll allow you access to those restrooms.
Great, thanks, Nicole. Yeah, I feel like being in a prison or being in down at the Capitol or one of those kind of places, being in a high school now. All right. So, has everybody picked up a copy of the agenda? We've got a pretty good agenda today, I believe. The first item on the agenda is that we're going to have Mike Hattori, and he's able to join us on the phone, but thank you, Mike, for joining us. He's going to give us an update on the merger between Rocky Mountain Health Plans and United Healthcare, and how it's playing out and how it might impact our healthcare delivery in Western Colorado. Mike, take it away.
Thank you, Steve. I'll make this relatively brief, and I'll take questions at the end if that's okay with everybody. Can everybody hear me all right?
Yeah, you're coming through loud and clear.
Okay. Well, as most of you know, and as I was just stated, Rocky Mountain Health Plan, I'm VP of Legal and Government Affairs at Rocky, and Steve, I'll just say that Steve Erkenreich apologizes. He had another board meeting, and he has a meeting in which introduce the AG, so he's over here in Denver today. Otherwise, he'd be there. I'm VP of Legal and Government Affairs at Rocky. As Steve said, Rocky has determined that it will be acquired by United Healthcare. Happened after considerable, I'll say, years of deliberation by the Rocky Board of Directors, and I'll just say we're a relatively small company or a small boat sailing in some pretty rough seas, and we thought with another company would be better for our members and frankly for the Western slope. That, United is a for-profit company. As part of that transaction, Rocky will have to convert from non-profit to for-profit status. And when that happens, the stock of Rocky will be held by the Rocky Mountain Foundation, the existing foundation. United Healthcare will buy that stock from the foundation for fair market value over into the foundation. As a result of that transaction, Rocky Mountain will continue in existence as a legal entity, as a corporate entity. It will continue in existence pretty much the same in Grand Junction and the Western Slope. United has made commitments to continue the Medicaid program, the Medicare program, current management and employees, to give additional capital, provide additional capital to make available all of the technological and software that it has. So those are some of the reasons why the board chose to for this transaction. That's a transaction in a nutshell. I'll go through the process and then tell you where we are and what the future holds. So as part of the regulatory process, the conversion from nonprofit status to for-profit status is under the jurisdiction of the Attorney General. The Attorney General has the primary duty to determine that the for-profit company is paying fair market value to the foundation. The other regulatory process is the Commissioner of Insurance, who has the duty to assure that the police and the insurance business will be conducted properly and for the protection of consumers. Both the AG held a hearing in Grand Junction and the Commissioner held a hearing in Grand Junction. There was testimony, pro and con at both of them, and both the AG and the DOI have issued separate orders approving the transaction. The AG determined that the value of the permit to the foundation, and so approved the transaction. The DOI determined that the members and the public would be protected with the plans that United has for the company. Here today with the transactions approved, we are this piece is not determined yet, but we are looking towards a close of the transaction by the end of the month. That may or may not happen, but at the end of the month, I can tell you how many teams of lawyers, accountants, actuaries, and all that are involved in the process. But that is the goal and the expectation right now. So what happens when this transaction is closed? Well, the first thing that will happen is that United will pay the foundation something north of $30 million as the determined fair market value. I use that number in a general be a lot of reconciliation. There are claims that have been incurred, there'll be a 90-day reconciliation and another reconciliation. And it all depends on the status, the financial status of the business as of the date of close. So the financial people will determine cash to the foundation. United has said, as I mentioned, that they intend to continue the Medicaid program, the Medicare program. They intend to keep the current management team and employees in Red Junction. That's the plan. In addition, they will add additional capital to Rocky, so the financial security will be assured. Let me talk to you a minute about the foundation. So who is the foundation? Will be an entity, is an entity that is not affiliated any longer with United or Rocky. It's been completely reconstituted with a new board and new bylaws, new articles, and the like. The legal counsel for issue is Bernie Busher. He's been working on that diligently and working along with the Attorney General's office to make sure that everything is appropriate and proper with regard to the foundation. I mentioned a million. I'm saying 30 million plus because the national people have to give us a number. So that foundation will have at least that amount of money. It may get more. We have a Medicare claim on appeal that could be if we win, but that's contingent on winning the case. So the foundation's charge is to provide for health care in the Western Slope and rural counties. The new board has been appointed and approved by the Attorney General. They looked at it, the Attorney General looks at it to make sure there aren't any conflict of interest and to make sure that neither Rocky nor United will control this chair of the foundation is Jeff Kerr, who runs who is Mason County Health Department, and then some of the other names that you will, I'm sure, recognize, and some may be in the room. I can hear all the introductions, but Russ George, Dan Gibbs, Ellen Roberts, Errol Snyder. So we have, and there are some positions as well. Charles Rowe, Pat Rydell, Montrose. So that gives you an idea of the mix of the foundation. Their job to be good stewards of the money that they have, and then set up priorities and distribution and projects, quite frankly, for Western Colorado and the rest of rural Colorado. So in a nutshell, Steve, that's where we're going. That's the status as of today. I'd be happy to answer any questions, but someone's going to have to translate because I was having a hard time hearing the introductions.
Okay. Thanks, Mike. Does anyone have any questions for Mike? Anything about the foundation? Well, we're going to let Dan chat a little bit about that.
Hey, Mike, it's Dan.
Yeah, Dan's there. Okay, I didn't hear his name, but I thought he might be there.
Yeah. Thanks for that update, Mike. And I guess to give everyone a snapshot from my perspective, I would say, as we all know, on the West Slope, we have a lot of healthcare challenges. And when I received a call over, I guess it was probably late summer, from Bernie Busher to see if I wanted to be involved with this board, kind of jumped at the opportunity what the duties of a brand new board like this would entail. Because just imagine yourselves, you don't really know exactly how much money will come to this new foundation. The genesis, of course, is the Rocky Mountain Health Plans Foundation, but area as well, because Rocky has had a presence in that region as well. From starting from scratch, we don't know exactly, is it going to be $30 million, is it going to be $55 million, and with that, how much staff do you need? With that, what type of subcommittees do we need to figure out, okay, what are the real needs are in various different communities? It's been really fascinating to be a part of this. I'm on the finance committee, so we're figuring out how to invest all this money to figure out how we can make it perpetual and to really look at long-term financial assistance to communities, but new. And until we know exactly what the dollar amount will be like, we'll still kind of struggle exactly with figuring out how to get from point A to point B.
Any other questions or thoughts? I have a question for the answer. What are your limits and your constraints on what you can use that money for? $30 million seems like a lot to an outside person. This is not to pay claims and things like that. This is for other type of things, right?
Well, we're still in the process of really figuring out our values. Part of our first meeting, we're actually, looking at a poster board of exploring those topics of, how can we best assist people on the West Slope? And so we're still figuring that out, really. So
good. Yeah.
Some of my constituents wonder why the merger, why this was undertaken, and I think the real underlying question is what effect is that going to have on availability and cost of insurance.
Mike, that's for you.
Yeah, I heard part of it is the availability of health insurance.
Well,
is that the basis of the question?
It's more about what was the need for the merger, how is that going to impact those of us on the western slope. Is that right? Yes.
Yep. Okay. Well, I'll again, the causes the board looked at strategically these times. It's very difficult to be a small company. We are a relatively small insurance company. You don't have the economies of scale for IT investments that the other companies do. You don't necessarily have the providers to negotiate rates that other companies do, and and there's a lot of uncertainty in the world that we read about every day in the healthcare world. So the board decided that a affiliated entity that had those capabilities made sense. And after thinking about it, looking at it, they concluded that the transaction with United was in the best interest of the company, its members, and in the Western Slope. And in terms of what it means for the health insurance on the Western Slope, as I said, we have a Medicaid program that's the Medicaid Prime programs in 7 counties that will continue. The Medicaid RCCO program, the Medicare cost contract that is in rural Colorado and Western Slope will continue. The small group, large group, and individual business that we have right now, we expect to continue. Now, everything is subject to United in the mix. We made some very, very difficult decisions in the last couple of years as Rocky, and those decisions were made without, frankly, any consideration of United or any other company in terms of the individual market, because it's a very difficult economic proposition for us. That's the expectation. We don't expect to see. We might don't expect to see a loss of jobs in Grand Junction. We don't Rocky expands, so that would be the ideal. I can't make any promises, and no one could. Even Steve couldn't make it, or the board couldn't make promises about what the future holds.
Dan Gibbs, for United, they have new networks. They're automatically gaining relationships they didn't have before, because Rocky has such great relationships with, I would say, healthcare providers on the West Slope. For folks in the individual markets, you live in Mesa County, because it's less availability. We had a lot of people in Summit County that had Rocky Mountain Health plans in the individual market, and now that's gone away. So, big picture, it's for the individual market, it's not as good.
J. Paul. I guess this is a rhetorical question. Who's your competition?
Sorry.
Mike, did you hear that?
I heard J. Paul say it was rhetorical, and I know J. Paul, so I could only guess, but I couldn't hear the just.
So the question is, who is your competition?
Who's the competition on the western slope? And that's the primary competition for us right now. United does not have any particular presence on the western slope. So we're individual business, and then Cigna is there. The other companies are there as well. You'll see Humana, Aetna, but in terms of up and down the western slope, United is probably Anthem is the biggest competitor, not United. I'm sorry.
Anyone else? Here, seeing no questions. Thank you very much, Mike.
Thanks, Steve. Happy to be here.
All right, thank you. Linda Gann from Connecticut Health.
Hi, can everybody hear me? I'm going to just stay here and will this move the slides?
Mm-hmm.
Okay.
Yes, ma'am.
First of all, it's always good to be back. So we're Connecticut Health, Colorado. I'm starting my 5th year, believe it or not. I came on board in February of 2013 when we were just designing what the marketplace was going to look like, developing policies. We have now completed 3 full open enrollments. What the plans look like for this plan year, which is 2017, and answer any questions you might have. Okay, so first our annual report. It's interesting how we were created. We are a nonprofit created by Colorado statute, bipartisan legislation. We have a calendar year based on. We also have a fiscal year, which is July through June. So if you see these terms throughout the presentation, that'll may seem a little different. That will explain that. But we did just publish our annual report for 2016. This is what is delivered. It gives an update. I'm going to give you some of the high-level overviews. More Coloradans were covered than ever before. Last year we had 175,000 covered most every community and certainly in every county. We have 400 guides. Those are grant funded through for community-based organizations. In Grand Junction, that's Hilltop Health Access. In Montrose, it's Volunteers of America. They're different across the state. We also have a customer service center. 55% of our customers have tax credits and cost sharing reductions. Those are only available through the marketplace, through us. In other words, the plans that we sell in our marketplace are also available outside direct from the carriers. But if a Coloradan qualifies for those tax credits, price. So that's just so you know, that's important. An interesting thing in sort of the way that we think we bring a value proposition to Coloradans is last year $318 million in those federal tax credits. In other words, that's federal tax money returned right back to Coloradans. Coloradans' uninsured rate reported by the Colorado Health Institute 2015 is now at 6 points.
We've only been doing this survey for 10 years.
Yeah, so since records have been kept. An interesting side note is 41% of our customers were under the age of 35. This is an overview of our financials. Once again, through the end, this is where it gets complicated. This is through the end of December, but we still have 6 months of our fiscal year left. More Coloradans were covered as over the last fiscal year, Connect for Health Colorado continued to migrate towards a fee-supported organization. All funding from federal grants has closed out during the year, and the broad-based assessment on health insurance companies also ended on December. Revenue sources, we have reduced our expenditures accordingly, and our board approved the fiscal year 2017 budget in June, which projects a positive cash position. In addition, our 24 and 36-month projections demonstrate our, you can see right there, is this working? Well, what I was going to call your attention to on the chart is the 609 copy that we've been able to do that. Next, kind of in line with that, is we were interested to see what economic impact we as an organization have on the state. We worked with BBC Research and Consulting, who CalMax created by Connect for Health Colorado. Connect for Health Colorado directly creates 373 jobs across Colorado. You can see we have a full-time staff of 66. We have contractors of 298. Those are primarily, we have some independent consultants. When indirect and induced effects are included, Connect for Health's operations create employment opportunities for 540 people statewide. Table shows is the payroll income associated with the jobs created by Connect for Health operations. We directly produce $20.5 million of payroll income each year. When the indirect and induced effects income What's interesting is you can see these are numbers through the end of January. We're at 176,000. Remember my previous slide, we were at 170. We've already exceeded that number. And even though open enrollment has concluded, we continue to see historically, and we don't anticipate much change in that. Throughout the year, 3,500 to 4,000 people moving into the state, losing their jobs, changing jobs, having a baby, those sorts of special events that allow them to come in and sign up for insurance. So while our largest enrollment period has just ended, this is just, let me get down here to my notes. This is a pretty fun thing. I know the slide is a little bit like an eye chart, but what I ought to be proud of with our exchange, we've always been one of the most successful state-based exchanges in the country, and we remain that way. Many exchanges did not see an increase in enrollment as we did. This is the Clear Choices Health State Health Insurance Marketplaces and Healthcare.gov, the federal exchange, on the tools that we provide our customers to help them choose the coverage that they need. Connect for Health Colorado was ranked second. So we're pretty proud of that and wanted to compare us to other exchanges where we're rising to the top. So now, I wish I could tell you more about this topic, but I can't. But I will tell you what we do know. 1703, which would repeal Connect for Health Colorado and move us into the move Colorado into the federal healthcare.gov marketplace. As a point of history, that bill has been a bill that's won some of that business, and it's not passed. I think this year, because of the conversations at the federal level, it's getting a little more press. It has passed through the Senate Finance Committee on a party line vote on February 7th. Its sponsors are Jim Smallwood and Patrick Neville. You know, they had a hearing. There were 50-some people that came to the Capitol and testified. Most were in favor of keeping the marketplace in Colorado and loss of jobs going to DC. They suggested, why would we move Colorado's exchange now when there's so much uncertainty at the federal level about what they're going to do? Why should we leave something that's successful anyway? So that was sort of the people that are opposed to this. And Club 20's position has been to oppose this bill.
Is there a reason for, you just gave us why opposed to it, what are the reasons for opposing it?
Well, you probably need to speak with the people that have done it. I don't want to speak on their behalf. And perhaps my friend.
We watched the legislation.
Yeah.
So we watched the legislature. I wouldn't want to characterize a sponsoring motives for passing a bill, and
what we are, what we aren't, is really important, because I did hear at the hearing, the sponsor of the bill, after all of the people spoke, he says, but everybody hears from the front range. I don't see anybody from the rural region. So again, Colorado or Club 20's voice is really important, and we really appreciate the support that we've gotten. In closing, our enrollments are up, our budget is balanced and sustainable, and that's not to say, however, that we don't continue to face challenges. Premiums are way too high, particularly for hazardous slope, only have one insurance company to choose from. Some Coloradans are foregoing care because of the prohibitive out-of-pocket costs. Those are all things out of our organization's control, but we choose. A coalition made up of 108 businesses, including Club 20, has pulled together this Colorado Health Policy Coalition, and they are working across the state to. Oops. What should we talk about this? This. Yeah, no, we'll go here. Okay. So, sorry, I got to have myself on my presentation. But we hear repeal and replace, or now repair. We are monitoring it closely along with our community partners. What we do have, we received last week, was some post-Medicaid services, CMS. That's the organization that oversees
Western Slope dealing with this stuff.
Right, and I mean, but, not to say that, events don't occur, but we have a strong commitment to customer service. We think that's under social media. And so anytime somebody posts something on Facebook, Twitter, something, same thing, we immediately respond and we can do that. But I'm sorry for what happened to your constituent, and please, if there's good number to have, and I don't mind at all.
And that's true from a broker standpoint. One of the nicest things about having Connect for Health Colorado in Colorado is the tremendous partnership in getting untangled and through the system. Connect for Health Colorado is required by law to let consumers know that there are agents and brokers available to them. And I want to thank you for bringing up the proposed changes and rules that are coming up. One of the things that I want to emphasize about these proposed rules and changes is that it's really the insurance companies right now. I mean, as you all know, we have one insurance company in the individual market on the Western Slope. Some of the biggest issues are the special enrollment periods not being checked, the advantageous for an insurance company to take somebody that is ready for surgery for a few months and then drop off. So this proposal is just a little baby step. There's still a lot of offer health insurance in our markets. So I encourage you to look at it. Yeah, shortening the open enrollment period is not going to be fun for brokers. But what it, instead of, I've got 3-4 months, I can get it done at the last minute. I don't have to pay 2 or 3 months. And quite honestly, there are people that do that. So, thanks, Linda, for your
Thank you, Mr. Chairman. Linda, great presentation. As you know, we heard this legislative meeting in Denver here a couple of weeks ago, about 20. When you said you're getting a lot of enrollments, I wanted to answer that. And then the other part of that, first slide or second slide down at the bottom, we had a 6.7%.
For all of Colorado.
So we're at a population of about 5.4 million people in the state of Colorado, looking at almost double that by 2030. I mean, that's an impressive number, 6.7% uninsured.
Yeah. And that's the data that we're using. But I think that before the CARE Act, it was around 14.5 or 15%. Yeah. So we've done a lot. Colorado's done a lot. And then Colorado's Ohio is private payers are paying for the uninsured who get come into the emergency room and have to care for them anyway. So I personally was hopeful that once we brought that down, cost commission of 20 and others, to put some these tax credits, and these tax credits are significant. I mean, you see there, the average tax credit in Colorado is $200 higher, but the tax credits equalize it. So those people that qualify, again, not everybody does, equalizes that. But we've got to find it because most people think tax, each county, health and human services, person to try, you know, we know these people are there, they come to you here, give them a card, here's all the brokers in their community, here's all the continuing outreach, and hopefully, you know, bring in the numbers. We're constantly looking for customer stories. I mean, I can get up here, I can talk to every group, and I appreciate the opportunity to do so. But if we have any consumers that in your area that would be willing to share their story, we would love to. Give you my card, I do that. That's the other part of my job is getting consumer stories. So those are the things we're doing. Small market. We also have a shop. We also have a small business marketplace where businesses 2 to 100 can shop for health insurance. We think the value proposition we bring, you don't really understand all this stuff. You can tell us, I want to, you know, I want to contribute this much money to each of my employees. I don't care what plan they pick. You might pick something different than you might pick, and you might pay to pick the plan. That small business marketplace is always partnered with a broker. And we think that's an opportunity for a couple of reasons on the western slope. I'm excited about it because there's more opportunity. So we're starting to work with chambers of commerce and the Small Business Development Council, Colorado Public CPAs. We roll it out.
One final question, Tom. And I was just going to kind of respond to Commissioner Gann and also Commissioner Gibbs. That's not that, only 11%. But if you take that and put it into the individual people who buy individual coverage, I would say that is probably closer to
attractive from a business perspective. And so we want to make sure that those companies that are getting the state business are advisor to offer individuals to offer insurance on the western slope in Region 9 in order
That be strictly Region 9, or would that be, you know, the Front Range region as well, the Eastern Plains?
we would require also and if they have to be in one region, they have to be in Region 9. So it would just be, it's really targeted at where we have the most competition. Everybody wants to be in the metro area, but it's a much harder sell to get carriers into the rural regions. And so that's why we're focusing the well, well, I think if they want that business, you know, we think that the state dollars ought to be put towards companies that are big corporate citizens. They're not making money anywhere in the individual market. So it's not just the West. But if everybody thought like so united, Humana, that kind of thing of creative ideas that will allow us to use the purchasing power of the state. We don't think that's going to be a problem, but you know, like I said, the lieutenant governor, having been the CEO of Kaiser, read 5 different bids. We chose 2 whether it's be here, you know, there's definitely costs that are getting shifted around, right? But ultimately, we'd like to lower the costs, right? You know, so part So, you know, I think we're interested in talking about ways that we can shortly and talk about, if you're a small business or